that shortness of breath climbing one flight of stairs, the exhaustion that sleep never fixes. You've probably blamed it on age or being out of shape, but I've seen this pattern hundreds of times in hospital, and it's often something else entirely. There's a valve in the center of your heart that can spend decades slowly narrowing, with almost no warning. By the time most people find out, it's already severe. I'm an internal medicine doctor, and these are the 7 signs your heart valve may be closing, and knowing them could save your life. The first sign is maybe the most common and easiest to dismiss: fatigue. But this isn't just, "I had a long day" tiredness. We're talking about a heavy, deep-seated exhaustion that feels way out of proportion to your daily activities. People with aortic stenosis often describe a profound weariness or a total lack of energy that just wasn't there 6 months or a year ago. You might find that things you used to do easily, like gardening or playing with your grandkids, now leave you feeling completely wiped out. So why does a narrow heart valve make you so tired? It all comes down to fuel delivery. Since the aortic valve is tight, your heart can't pump enough oxygen-rich blood to the rest of your body to meet its demands, especially when you're active. Your muscles, your organs, and your brain are all running on a low fuel light. The result is a constant state of low energy. Because this fatigue creeps in so gradually, it's often mistaken for just getting older. The real red flag here is a noticeable drop-off. If you feel like your energy levels have fallen off a cliff and you can't do what you used to, that's not just aging. That's a signal you need to pay attention to. The second warning sign, which often goes hand in hand with fatigue, is shortness of breath. Initially, you might only feel it during moderate activity, like walking up a hill or a few flights of stairs. You might find yourself pausing to catch your breath more often than people your age, or feeling winded after activities that used to be a breeze. The reason for this is directly related to the pressure backup from the tight valve. When the left ventricle struggles to push blood forward into the aorta, pressure can build up backward, flowing from the left ventricle into the left atrium, and then into the blood vessels of your lungs. This is called pulmonary congestion. Think of it as a traffic jam backing up from the main highway onto the side roads. This pressure can cause fluid to leak into your lungs, making it harder to breathe. As aortic stenosis gets worse, the shortness of breath can become much more serious. You might get breathless with even minimal activity, like walking across a room. A particularly concerning sign is having trouble breathing when you lie down flat, forcing you to prop yourself up on pillows to sleep. This is a strong indicator that the heart is really struggling. If you find your breath is limiting your life, it's a clear signal from your body that your heart is under serious strain. Sign number 3 is a big one: chest pain, or what doctors call angina. Patients often describe it not as a sharp pain, but as a heavy pressure, tightness, or squeezing feeling in the chest. This is typically brought on by physical exertion and goes away with rest. The feeling might also spread to your neck, jaw, shoulders, or arms. What's causing this? It's a supply and demand problem for the heart muscle itself. Remember how the left ventricle has to thicken to generate the force needed to push blood through the narrowed valve? That bigger, harder-working muscle needs more oxygen. But at the same time, the aortic stenosis is limiting the amount of oxygen-rich blood that can get out of the heart to feed the coronary arteries, the very vessels that supply the heart muscle. So when you're physically active, your heart beats faster and its demand for oxygen skyrockets. But the supply, choked off by the tight valve, can't keep up. This imbalance causes the heart muscle to cry out in pain, which you feel as angina. It's important to know this is different from a heart attack. Angina from aortic stenosis usually comes on predictably with exertion and stops when you rest, while heart attack pain can happen suddenly, even at rest, and is often more severe and lasts longer. The appearance of angina is a crucial turning point. It signals that the stenosis is severe and the heart is in the danger zone. Once this symptom appears, the prognosis without treatment gets dramatically worse. This next one can be really frightening. Feeling dizzy, lightheaded, or even fainting, especially during or right after physical activity. Medically, this is known as syncope. Someone might describe suddenly feeling faint after climbing stairs or getting up too quickly. This happens for a very simple reason. The brain isn't getting enough blood. When you exert yourself, your muscles demand more blood and oxygen. Normally, your heart just pumps more to meet that demand. But with severe aortic stenosis, the valve is so narrow that the heart is physically unable to increase its output enough. It's trying to pump harder, but the bottleneck at the valve stops more blood from getting out. As a result, your blood pressure can drop suddenly, leading to a temporary shortage of blood flow to the brain. This is what causes that lightheaded feeling or a graying out of your vision. If the drop is bad enough, it can cause you to faint. Fainting is a major red flag. It indicates that the aortic stenosis has become critical, meaning the valve is so tight it's seriously compromising the heart's ability to supply the body, and especially the brain, with blood. This symptom requires immediate medical evaluation. Have you ever felt your heart suddenly racing, fluttering, or skipping a beat? This sensation is known as palpitations, and it's our fifth warning sign. Now, we've all felt our heart skip a beat from too much coffee or stress, right? But when palpitations happen along with other symptoms like shortness of breath or fatigue, they can be related to aortic stenosis. The immense strain on the heart can disrupt its normal electrical rhythm. First, as the left ventricle gets thicker and larger, it can stretch and irritate the heart's electrical pathways, making abnormal heart rhythms more likely. Second, the pressure that backs up into the left atrium can cause that chamber to enlarge too. An enlarged left atrium is a major risk factor for developing atrial fibrillation, a common condition where the heart's upper chambers beat chaotically. You might feel this as a rapid, fluttering sensation in your chest, or you might just become aware of your heartbeat when you normally wouldn't. These irregular beats are inefficient and can make other symptoms like dizziness and fatigue even worse. While palpitations aren't as specific to aortic stenosis as chest pain or fainting, if they're new for you, they should absolutely be part of the conversation with your doctor. Sign number 6 is less of a single event and more of a slow, sneaky change in your life. A decline in your overall physical activity. This often happens without you even realizing it. Maybe you used to walk 18 holes of golf, but now you always take a cart. Maybe you've stopped taking the stairs at work, not because of a conscious choice, but because it just feels like too much of an effort. Cardiologists often ask patients to compare what they can do now to what they could do 6 months or a year ago. Can you still carry in all the groceries in one trip? Often, people unconsciously adapt their lives to their symptoms. They do less and less to avoid feeling breathless or tired, and they blame this slowdown on just getting older. This is a particularly dangerous part of aortic stenosis, because this new, more sedentary lifestyle can hide how severe the disease really is. If you or your family have noticed that you've significantly cut back on your activities, or that your physical world has started to shrink, it's a powerful sign that something more than just aging is going on. And our final warning sign is something you might notice in your lower body: swelling, or edema, in your feet, ankles, and legs. You might notice that your socks leave deep marks at the end of the day, or that your shoes feel unusually tight. This isn't an early sign. Swelling points to late-stage aortic stenosis and is a symptom of congestive heart failure. Here's how it happens. The overworked left ventricle eventually becomes so weak that it can't pump blood forward effectively. This causes a major traffic jam in the whole circulatory system. Blood returning to the right side of the heart can't get through the congested lungs efficiently. This backup increases pressure in the veins, forcing fluid to leak out into the surrounding tissues. Thanks to gravity, this fluid pools in the lowest parts of the body, your feet and ankles. The appearance of swelling is a critical sign that the heart is losing its battle. It indicates that the heart muscle is failing and the circulatory system is overwhelmed. This symptom demands urgent medical attention. Okay, after hearing all that, it's natural to feel a little worried, especially if some of those signs sound familiar. But my goal here isn't to scare you, it's to prepare you. It's vital to remember that all of these symptoms, fatigue, shortness of breath, even chest pain, can be caused by many other less serious conditions. However, you should never ignore these symptoms, especially if you're over 60 or have known risk factors like high blood pressure or a congenital heart issue. The key is context. A single symptom might not be alarming, but a combination of them, or a clear pattern of getting worse, is a strong signal to see a doctor. The difference between normal aging and a heart problem is often the change, a decline from how you used to feel. The worst thing you can do is dismiss these signals. A simple checkup can give you peace of mind. So what happens if you go to the doctor with these concerns? The good news is the diagnostic process for aortic stenosis is very straightforward and painless. It almost always starts with a doctor listening to your heart with a stethoscope. Aortic stenosis creates a very distinct heart murmur, the sound of turbulent blood rushing through the narrowed valve. Hearing this murmur is often the very first clue. To confirm it and check the severity, the gold standard test is an echocardiogram. This is just an ultrasound of your heart. A technician uses a probe on your chest to create live images of your heart's chambers and valves. This test lets your doctor see the aortic valve, measure how well it's opening, and check how it's affecting your heart muscle. It's a non-invasive, definitive way to know exactly what's going on. Based on the results, your cardiologist can tell you if the disease is mild, moderate, or severe, and recommend the right plan. If this breakdown of heart health has been valuable for you, and you want to learn more about protecting your most vital organ, please take a moment to subscribe and click the notification bell. Your support helps us create more content just like this. So let's quickly recap the 7 signs. Unexplained fatigue, shortness of breath, chest pain with activity, dizziness or fainting, heart palpitations, a decline in your activity level, and swelling in your legs. While aortic stenosis can be silent for years, the appearance of symptoms marks a critical turning point. Untreated, symptomatic severe aortic stenosis has a very poor prognosis, with survival rates dropping fast within just a few years. But here is the most important message I want you to take away. This condition is treatable. Modern medicine offers incredible solutions, from minimally invasive procedures like transcatheter aortic valve replacement, TAVR, to traditional surgery that can replace the faulty valve and restore normal blood flow. Most patients who get treatment can go back to a normal, active life. The key to a great outcome is catching it early. Don't write off these signs as just getting old. Your body is communicating with you. Listen to it. If these warnings resonate with you or someone you love, please make an appointment to talk with your doctor. Taking that one simple step can turn a quiet warning sign into a life-saving action plan. Thank you for watching.